I had first noticed that I had a lump about 2 years before I actually did anything about it. It got to the point where I couldn't ignore it anymore. The mass was definitely very large. I was starting to get pain from it, and I had to do something. And the fear of there being something wrong, of it probably being cancer, was greater than the fear of not being able to afford to pay for health care. I was too afraid because I didn't have health insurance.
The Breast Health Patient Navigator program was funded through the Susan G. Komen Foundation, particularly the division of New Hampshire and Vermont. The real purpose of navigation is to make sure everybody doesn't feel alone, that whoever's going through this process never feels like they are on the outside of this big box facility that they can't breach the walls of to come in and get the services that they need.
Hi, how are you?
Good, how are you?
Good. What brings you here today?
I found a lump in my...
Your job as a patient is to get better.
The Navigator program is there to help the woman get through her appointments and any questions that she might have and any fears that she might have as she goes through the process.
It shouldn't be your responsibility to make sure your records get there on time. There should be somebody in the healthcare network that's doing that for you. This program's just been kind of the conduit for that to happen.
I'm a librarian, and my job is to help find information, help people find things that they need, and I just got so confused and so frustrated. I was going round and round in circles and getting nowhere, and I said, this is absolutely useless. What am I going to do now?
It's different for each patient. Their needs are different. Marilyn, who, her need was based on financial, and other patients, it's simply knowing when their appointments are. For some patients, it's been transportation. How do you get from the middle of Ossipee, which is miles from us, to come here for your mammogram? Maybe you need to bring your 6-year-old with you, and it's as simple as providing a coloring book while you have your mammogram done. It just depends on what the needs are, and my job is to address what those needs are and have a very simple conversation about what your income is, what your family size is, how are you going to get to your appointments. It really comes down to the individuality of every woman involved in this process.
I was able to relax and concentrate on going to my appointments and doing what I needed to do just to get better.
A lot of patients need to know where to access care, how they're going to pay for their care, what the next steps are. Maybe it's as simple as terminology. What does it mean to have breast cancer? What does a tumor look like? What's the difference between a stereotactic biopsy and a core biopsy? My job is to help you make it through from your doctor's office to your screening, to if you need some testing done, that additional testing is set up, to your surgical office, whether it's here or somewhere else. If you need a test that we don't provide here, you may have to go to a breast center, such as down in southern New Hampshire or over in Maine. But then if you decide you want to have your treatment done here, it's the process of getting those records and those services back up to here so that you can seek your oncology treatment here, where your family and your friends are, and that transportation is easier for you.
We want women's recovery to be as easy as it can possibly be for them. So our job in the Navigator program is to take those worries away from them, and they can focus on getting better.
The reason for being here absolutely stinks, but I like coming here because I'm so well taken care of.